Well, back in studio, and our focus to our conversation of the day, and it is antimicrobial resistance, and perhaps you've heard it being called antibiotic resistance. But today you will find out there are many other antimicrobes that are out there that you can be resistant to. Now, just in case you're wondering what exactly we're talking about, well, we're about to delve into that in a moment, and you will see how close home it gets. Let me just remind you that question of the day to you so that you can be part of this conversation and start to unpack how it has been impacting perhaps your own life. And the question is, how often do you buy drugs over the counter to self-medicate, and why? How often do you just go to a pharmacy and just buy drugs and self-medicate? What are your reasons? I'd like to know. That hashtag is a new normal. And remember, you can give us a call this morning, even as we try and understand the extent of this issue. And just to give you a better understanding of what we're talking about this morning, if you can have the graphics. First, antimicrobial resistance is actually defined as a condition that occurs when infections become resistant to the drugs designed to treat them. Now, this is the layman definition. Of course, you'll be hearing from our panelists even as they help us to understand more what that means. And the WHO, as I had mentioned earlier, has actually sent out a warning signal, and it actually classifies AMR as one of the 10th greatest public, or rather global public health threats humanity faces today. So clearly something that we all need to pay attention to. Now, AMR is not only a human health problem, but also impacts on animals and environment. You ask how? We'll find out in a moment. And there was actually a research that was conducted the other day, and this is it was released by the Ministry of Health, but conducted by the Kenya National Bureau of Statistics and other stakeholders, that actually sampled 3 counties, Kiambu, Kilifi and Bungoma, and out of those 3 counties, it actually found out that 78% of the communities were not informed at all or knew very little about AMR. So you are amongst a huge population of many who do not understand what this is. But then again, after we're done with this conversation, you'll understand how this is so relatable to what or your health-seeking behavior. And to help us along with this conversation, I am joined in studio by Dr. Gavin Orangi. He is a clinical pharmacist. Thank you for your time. We are also joined by Patrick Malaki, who is a community health worker, and he is attached to the Kibera area. Joining us virtually is Joseph Osoga, who is a medical microbiologist. He joins us from Kisumu County. And of course, we have Dr. Evelyn Wesangula, who is the head division of patient and health workers safety at the Ministry of Health. Thank you all for being part of this conversation. Now, Dr. Wesangula, I think it is important that we start off by defining why it is so important, or reiterating the importance of creating awareness around antimicrobial resistance.
Okay, thank you, and good morning, everyone. It's a pleasure to be on the show this morning, and I'm excited to be part of this panel, just to be able to shed a little bit more light on what antimicrobial resistance is, what that means for us as individuals, as communities, as a country. I put it from the survey that was done, and we launched the report last week. A very small fraction of the population actually knows what antimicrobial resistance is, and even have heard what it is. It is just like you mentioned. I want to start by defining what antimicrobial resistance is, and maybe just also trying to demystify it. And like you rightly put, it's a condition, or it occurs when infections become untreatable by drugs or antibiotics, as we commonly call them, that have previously been effective when it comes to treating those infections. And infections are caused by different microorganisms. This could be bacteria, they could be parasites, they could be viruses. And the particular category of microorganisms or microbes or disease-causing organisms that we are really, really interested in are those infections that are caused by bacteria and would require what we call antibiotics to effectively treat them. So because of the misuse and overuse of this particular category of medicines, these infections have become untreatable. And like you said earlier, maybe I would just like to correct that. It is not the people who become resistant to an antimicrobial agent, but rather the organism that causes the infection is the one that becomes resistant to a particular antibiotic or an antiviral agent or an antiparasitic agent. So when this happens, so this brings me to the consequence, and this actually just shows why this is really, really important for us to address.
Okay.
If you cannot treat an infection, there's one thing that can happen. Either the cost of treatment increases because you require a better drug or a more effective antibiotic to treat, and the costs could be higher. And if eventually you have no option, then like you said, the number of people dying because of untreatable infections will definitely go up.
Okay, thank you for that perspective, and definitely it sheds more light on what antimicrobial resistance is all about. And even as we understand it further, let me hear from Joseph Osoga. I mean, Dr. Wesonga is talking about the misuse or the overuse of antibiotics or any other medication. How can you define that?
Yeah, so thank you so much, Kathy and Dr. Wesonga, for giving us an insight on that. So you do realize that as we live in communities, we often fall sick. And when we fall sick, we often seek for medications. But we do seek for medications before we kind of find out what is the cause of the sickness that we do suffer from. So in this context, I'll bring in the aspect of clinical laboratory aspect of things in detecting or isolating microorganisms that normally make us sick. So what are we supposed to do? So as scientists from this perspective, and also from the aspect of the medical doctors, what I would really think is that it would be fair if we consult or if we improve our clinical laboratory aspects to help us isolate the microorganisms and also perform what we call susceptibility testing so that we know which particular aspects of antibiotics we need to use to combat particular antimicrobial agents, microorganisms. Like, for example, there's a case of sepsis, which normally has been reported by WHO, and we realize that sepsis can really kill. So there are several organisms that cause sepsis. In this case, we talk about Staph aureus, we talk about strep pyogenes, we talk about Klebsiella and E. coli, among other microorganisms. So if the masses or the public could be kind of, sensitized about the use of the lab in detecting microorganisms before any kind of treatment is done or before anyone seeks for medication, then I think we are going to avert this particular pandemic so that by the end of the day, our community is going to be safe. The other aspect that I want to bring to your attention about, we realize that based on the definition that you just posted online, we realize that we have three aspects of things in this particular context. We have the animals, we have the humans, and we have the environment. So the environment is kind of, we have plants involved. So we do realize that when we just give people antibiotics or we misuse the drugs by maybe overdosing or underdosing them, then we are actually going to expose these people to resistance, just like we have said. But you do realize that the animal feces contain drugs, contain antibiotics. The fertilizers that are used on plants when we are planting contain antibiotics. All these can confer resistance in one way or the other. And again, you realize that bacteria is very clever. They have a number of ways through which they can handle some of these particular kind of aspects of things. So we have mechanisms that bacteria normally use to ensure that they confer resistance. And in this case, they have a number of things like limiting uptake of drug in them, modifying the kind of the drug targets that, that will make them die, so that by the end of the day, you realize that even bacteria will push drug out of their systems, making them become so powerful and being able to kill us. So I think it is high time that as a public or as an institution or as a country, we think in terms of doing what we call a one health system. So a one health system now, we are going to consider humans, we are going to consider animals, and we're also going to look at the plants, because we all live in one particular aspects of society. And without putting cognizance to some of these particular aspects, we are actually going to be in a very difficult situation. Thank you.
All right. Now we see the connection between human beings, plants, environment, and of course animals, and the impact of antimicrobial resistance in all these phases. And let me bring in Gavin. When we talk about underuse, misuse, of course, the one thing, and even our question of the day is actually alluding to the same. There is a lot of Kenyans that walk into a pharmacy and self-medicate. Why do you think this is the case? What are the reasons you hear?
Good morning. So the main reasons that actually are what we'd call drivers for misuse or overuse of drugs are, I think the first thing we'll probably look at the cost of the drugs. When you think about it now, our economy is not really doing that well like it used to. So you'll get the common mwananchi would actually prefer to actually go to a chemist or to a pharmacy and buy the drugs from the pharmacy directly, rather than go and seek a professional opinion from a clinician or a prescriber in regards to the same. The second thing is probably the availability and the low legislation that we have in our country. Ideally, and we're talking about the ideal scenario, you actually expect a patient or somebody who needs these drugs to go to the pharmacy with a prescription. So the gap now comes. If you can access these drugs without a prescription, so really, then why go to a hospital? So most people have easy access to the same. I think we also need to point out the fact that our legislation needs to actually be more stricter, more firmer on our chemists, on our pharmacies, so that you are not able to actually dispense or give these drugs to a patient without really the patient having a prescription. I also need to point out a few things that people usually tend to look at, which have brought misuse and overuse or underuse of drugs. A patient will actually, or we'll call them a patient because now this is a person who is seeking medical advice. They'll come to a chemist, and because now they are unwell, they will ask for an antibiotic or an antimicrobial. Why do they ask for that? Simply because you have a fever, and the person who is there or your friend told you that this drug worked on me, so it will work on you. So most people actually go for that. And the problem with that is probably it's not actually even the right drug, because as the microbiologist has rightly pointed out, it is very important, if it is an infection, to actually go and do a level of either biomarkers, that is something that can actually indicate or show that you have an infection, for you to treat an infection. So that is one. And then secondly, most people actually just underuse and overuse. The minute you use a drug, probably you were told to use it for 5 days. You did the right thing, went to the hospital, you saw a medical practitioner, and they found out that you had an infection. So they prescribed for you an antibiotic. So by the time you go to a chemist, you are given the antibiotic. By the time you feel better, what do? You stop the drug. You don't really go for the duration of the drug as it was prescribed. Also, overuse. A patient can actually use the drug longer because of the relief that they feel from using the drug. So probably those are the main aspects that I point out.
Interesting perspectives here. And if we can have some of that, of some of the graphics we had earlier lined up in as far as some of the factors fueling misuse of antibiotics, and some Gavin has actually alluded to. Let's have that on the screen. Out of this research that was released by the Ministry of Health, done by KNBS and other stakeholders in the health sector, actually showed that a majority do not follow doctor's prescriptions, as Dr. Gavin is actually mentioning, prefer to purchase medication without prescription by a qualified health worker. They have easy access to over-the-counter antibiotics. They fail to adhere to the recommended dosage. Some do not even use medication at all and rely on traditional healers. Institutional barriers, difficulties in accessing hospitals, low numbers of health practitioners, high cost of healthcare is just but a few of the factors that have been listed as fueling the misuse of antibiotics. Now, Patrick, you deal with those in the informal settlements and things like access to hospitals, affordability of the same. Do you see this playing a huge part in how people access healthcare?
Yes, this plays thank you so much for having me on the program.
Yes.
I'm Patrick. I work in Kibera. I think this plays a very big role because affordability, a common mwananchi, just as the pharmacist has said, would want to get something that is cheaper. Maybe a dosage for maybe an antibiotic is maybe 100 shillings. And this patient only needs to want to spend 20 shillings. That means he'll go for an underdose. So this, at the end of the day, makes it very hard for this patient to complete the dosage. Also, you can get that when a patient accesses a health facility and maybe she is treated or she's treated, the doctor will prescribe medication, or the doctor may require the patient to go for a lab test. So due to financial constraints, this patient will resort to going outside and buying medicine without going to the
for the lab test.
So you think you'll find that some of maybe the causes of the disease, some may be a viral disease or a bacterial disease. So you are just going to buy antibiotic without knowing what is the real cause of what you're suffering from. And also, in terms of poverty, we also have you cannot get money to buy the drugs. So what you do, you go to your next neighbor and try to borrow. So you are like, do you have any capsules or any antibiotic? You help me. So you see, you're going to borrow a capsule for 2 days or 1 day. So you spend it that day, and that is it. So, and also we have that tendency of people when they take their medication first or second day and they feel they're better, that is okay for them. So they're going to leave that medication there. So I think the community members and even Kenyans should be advised to always seek medication where you're going to meet the professionals, a professional pharmacist, and make sure you complete your dosage.
Okay, let me ask Patrick, when they are resorting to these options, when it comes to access to healthcare, do they understand the effects it might have on their well-being?
I don't think they understand the effects of what it may have in their lives, because what these people need is just a one-time thing, just to get that medicine, take that medicine. If he feels well, he's good to go. Yeah.
Okay. Now, I want to understand, Joseph, and perhaps you can help me out here. Who taught us that antibiotics is the answer to everything?
So I would, first of all, before I answer your question, one thing that I would wish that the community embrace is that the community need to embrace lab testing. Just like my colleague has just pointed out, before any medication, before any treatment begins, I would wish that the community is informed that you attend to a lab for a particular test to be done for you to find out the real cause of your problem, because you can, before you can easily go and buy a drug or be treated. I also would wish to reach out to our medical doctors that they also embrace lab tests, because it is through lab tests that all this information begins. You realize that almost 60% of data of all health informations come from the lab. So if we don't embrace the lab test and give the lab scientists and people who are helping us diagnose disease the power to kind of, give us what is there, then I think that's where we begin to lose it out. because you realize that in many situations, like in this country, many labs in this country do not have microbiology labs. So like you do realize that the constraint behind this is the aspect of biosafety and biosecurity that comes with the bacterial isolates. Because you realize that once you isolate a particular bacterial pathogen, containing it becomes an issue. So this is what is really becoming a big problem to many labs in Africa, not only Kenya. So if we could strengthen clinical labs, just to have to be in a position where they can afford to have a biosafety level 2 cabinet where they can manipulate some of these microorganisms, not very pathogenic ones, but just within that particular context, then I believe to some extent we can isolate some of the let the doctors know, okay, this is the kind of microorganism that we have isolated from this particular sample, and we have done our susceptibility testing, and this particular pathogen is sensitive to this drug or is resistant to this drug based on this particular method, then it will give doctors an opportunity to, prescribe the right medicine for this particular individual. But you realize that in many
Joseph,
yes.
Let's now answer the question I posed to you. Are you saying the doctors perhaps are the ones that made us get used to the fact that antibiotics result or give us the results we need?
No, okay. They are not the ones who have made this happen, but I'm just saying that if both the lab, the doctors, the pharmacists, the clinicians work together before any kind of, a prescription to the drug is given, then a diagnosis have to be done. You know, when you do a diagnosis, you get a positive result that will tell you whether there is the presence or absence of a disease.
All right, Dr. Wesonga, from the research, are there particular things that came out of the research to show that Kenyans have decided or know that antibiotics is the way to go, whatever they're suffering from?
Okay, thank you so much. Actually, it's Wesangula, not Wesonga.
Wesonga, sorry.
Yes, Wesangula. So I just want to maybe make one thing clear. That antimicrobial resistance is one of those things we make reference to as a wicked problem. What that means is that it has multiple root causes. It's not one single cause that actually has driven us to where we are right now. And just building on what Joseph, Gavin, and Patrick have said, as you keenly listen to them, each of them has a different perspective. So that means that the system has to work. Every piece of the puzzle must fit for us to be able to contain what the problem that we are facing or the threat that we all are aware that is looming. So even if I fix the lab and I don't deal with the knowledge issues and the attitude issues, I will not be able to solve the problem. Even if I work on the cost issue when it comes to affordability of the medicines, and I don't fix the laboratory, I don't fix the supply chain, meaning that when I need that drug, it is actually available at the point of care, then I will not be able to have fixed the problem at the end of the day. So when we look at antimicrobial resistance in terms of how we want to address it, we look at a whole spectrum of issues, right from research and development. And right now we know that very few pharmaceutical companies are actually investing in the development of antimicrobial agents. And why is this so? No one is interested in developing a product which will have a resistance developing towards it within a very short time. So the pharmaceutical industries will not be able to have their returns on investment. So we are seeing a dip in terms of the numbers of new antibiotics we're seeing in the market, and that is quite worrying. And when you move up the chain, you're looking at issues like distribution, I'm looking at supply, I'm looking at selection, I'm looking at procurement, and all this will be guided, let's say, by the lab, which plays a central role. If we don't have the right results in terms of sensitivity and resistance, we will not select the right drug, we will not be able to procure if costs are high, and if the facilities are not accessible, then the distribution process also affects it. So what that means is that even if a patient gets to a healthcare facility and that particular drug hasn't reached that health facility, they might go into a laboratory, get a test done, well and good. They'll go to the clinician, have the right prescription, for them done. When they get to the pharmacy, is the drug available? If yes, they will receive the drug and they go home. They're the end users. If they don't have the right information regarding its use, and you see, it's a whole cycle that actually needs to be fixed at multiple points. So the study findings were quite clear. One of the key findings was poor knowledge about these antibiotics and their proper use, and not just for the public, but even for the professionals. And we know that, like Patrick says, the citizens will obtain this information from the interactions with health workers and even people within their villages or communities. And if you don't have the right knowledge, then you're bound to mislead or provide the wrong piece of information to your neighbor or to your colleague at the end of the day. And of course, that contributes to risky health-seeking behaviors, which we are seeing. And especially the COVID pandemic has fueled this. And we have seen a lot of the citizens or members of the public publicly buying antibiotics over the counter, like azithromycin has become very famous. Initially, this was a drug that was reserved for provision or dispensing upon the provision of a prescription. So that is very risky, because apart from resistance, you also have adverse drug reactions that a patient can actually end up with, because they don't have the right knowledge. They will end up using the drug in the wrong way, and either get benefits in terms of treatment or an adverse drug reaction would occur. So those are just some of the things that I would want to say. Let's look at the problem from a holistic perspective. And we say that there's no single sector that can fix this problem. We need to be able to each fix our piece of the system to enable the system to function in an optimal manner.
Okay.
So apart from the, yes.
All right. Now, at this point, I think it's good to underscore that there's also personal responsibility involved here.
Yes.
That if you are unwell, go to a doctor, get the prescription, and be able to get the right medication according to what you're ailing from. And that's why I'd like to hear from that question of the day: how often do you buy drugs over the counter? What are your reasons for the same? That hashtag is new normal, and this is something that will help us also understand some of these risky behaviors that our panelists are talking about. Hilary Okudo says, if the illness does not require an operation, then I will just go to the chemist. The living situations have forced me to do so. Hilary, thank you. Another here from Peter Wanjo, he says, like every time, because even the hospitals in Nyeri County don't have medicine. Interesting. Okay, and then Elvis says, most of the time the hospital here can only test for malaria. Once malaria is negative, unaambiwa hakuna ugonjwa. Okay. I hope we are taking note of this. Don Jontes says, high consultation fee. Okay. Martin says, frequently, sana, if the illness is not serious. Okay, Martin, thank you. Another here from George who says, we buy food instead because of the budget. All right, so you'd rather focus on buying food than having to go to hospital. Eddie Moria here says, mine just go by themselves. All right, that means he actually does not go to seek health care from his health facility. Now, here's the thing. There is a huge, as you've heard, there's a huge connect in as far as how we acquire or procure medication over the counter and the resistance that we are seeing today. But then again, there are different aspects to this. When we come back, let's understand, apart from antibiotics that we keep hearing over and over again, are there any other medications that the doctors are saying do not go and get over the counter or self-medicate on? We'll be right back. Thank you for staying with Your World. My name is Gladys Gachanja. Today, the conversation is antimicrobial resistance. And still with us, Dr. Gavin Orange, who is a clinical pharmacist. We have Patrick Malaki, who is a community health worker attached to the Kibera area. We have Joseph Osoga joining us from Kisumu. He is a medical microbiologist. And Dr. Evelyn Mesangula, who is the head division of patient and health workers safety at the Ministry of Health. Thank you all for being part of this conversation. Now, Gavin, perhaps you can tell us, we've talked about antibiotics, and I think this is what most people identify with when they go to the pharmacy. What else have you seen that people ask for a lot without prescriptions?
Okay, so probably today is World Animal Day, so probably I'd like to point out that you'll get that most poor pharmacies actually also have agrovets, and they usually just come for the drugs, the antibiotics that they use for the animals. So while we celebrate that, it will actually be good also to point out that you also need to take care of your animal, and you can do that by probably making sure that you see a vet before you get that antimicrobial. Now, back to the antibiotics, most people usually come because of the misuse, overuse and underuse of drugs. You'll find that most people have developed, how can I say, in their own perception, a level of resistance to the drugs. So most of the people, when they come to the pharmacy, they tend to actually ask a lot for what we call the broad spectrum antibiotics. And if you look at the WHO classification of antibiotics or antimicrobials, you have the access class, you have the watch, and then you have the reserve. So most of the people who usually come there, they usually ask for something that is closer to access. Basically, when we say access, we usually mean that these are drugs that are usually available and can be used as a first line for the treatment of any infection. Watch are the drugs which need to be prescribed by, of course, all of them need to be prescribed by a qualified personnel, but these are the drugs that now we'll call probably the second line. And then for the reserve, ideally you should actually have a team of clinicians who actually prescribe that. So most of the people, and unfortunately, you have your access, watch, and reserve drugs. All of them are actually available in our chemists or our pharmacies. So most of the people will usually come, and because now you're looking at the pharmacists or the pharmaceutical technician who's actually in the chemist, and they'll be like, you need a drug, and based on the cost, I'll get more money. And this drug is stronger. So they usually tend to dispense what is in the watch category or what is in the reserve category.
So the stronger version of the antibiotics?
Yes. So the stronger version of the antibiotic, the better. So, for example, I know we are speaking to the public, so I know most people are actually aware of penicillin, amoxicillin. Yeah. Amoxicillin is actually a common antibiotic in the community. Now, funny thing is, amoxicillin used to be a very good drug and is still a very good drug. But because of what people will tend to think that it is a weak antibiotic, they'll go for something like amoxicillin, clavulanic acid. Commonly, people usually call it augmentin. Yes, so most people will tend to go for that, and you'll realize now that is now a combination of two antibiotics. So really, you have jumped from what is basic, what you probably needed, to something that is a bit stronger. Now, the antibiotic or misuse or underuse, or let's call it the misuse of antibiotics, people tend to also do misuse of other drugs. There are other drugs that people tend to misuse. And most commonly, I think it was flagged, I think recently, was the misuse of codeine in the cough syrups, which was, I think, very rampant. And then people tend to misuse also painkillers, things like the opioid analgesics, things like tramadol. Ideally, these are restricted drugs that should be placed under lock and key and actually dispensed by use of a valid prescription. But unfortunately, because I think, and that is something that needs to be strengthened, is the legislative or the regulatory framework of the same, so that now you don't just go and get an antibiotic or any of these drugs the way you'd go and get, let me just put it as bread and milk.
I hear you.
Yes.
Okay, so Dr. Besangule, now that the Ministry of Health is a big brother here, but of course there have been calls in other sectors to ensure that the pharmaceutical body is actually, overseen by a bigger body to ensure that we regulate what Gavin is talking about. What ideally works in Western countries where prescriptions are so strict, yet in this country you can walk into any pharmacy and self-medicate?
Okay, thanks, and thanks, Gavin, for shedding light on that bit. And like he has rightly said, the enforcement of regulation has been weak, and we recognize that as a gap at the country level compared to the Western countries. And that's one of the things that is actually being strengthened right now as we work on trying to contain, especially the antimicrobial resistance aspect. We have a policy that's been developed, and we recognize that to support the optimal use of antimicrobial agents, and this will cut across all other drugs, there's a place of what we call antimicrobial stewardship, and there's a place of legislation and regulation and the enforcement. And I look at it from two perspectives. One, there's the place of the government and authorities that are in place, like for us, it's a Pharmacy and Poisons Board, to ensure that actually the legislation that has been developed is actually enforced. That is one aspect. The second aspect, which I also would want to point out, is the place of self-regulation. As a trained professional, as much as you want to make your bottom lines at the end of the day, where is the place of self-regulation? You very well understand as a professional, whether you're in the vet sector or in human health, that some of these drugs that we are talking about today are actually prescription-only medicine. As much as the government is going to strengthen the enforcement of the legislation, what is our role as healthcare professionals? Where is the place of self-regulation? Because I think it begins with us at the end of the day. I am the one that's behind the counter. So what is it that's going to push me to go against what I so very well know is the right thing that I need to do? So as much as the government enhances the enforcement of the laws that have been developed, the healthcare professionals also have a big role to play in terms of self-regulation. And I think that's one of the things that's going to be critical to help us ensure that the masses are safe at the end of the day. Okay. I also just want to point out that the policy that has been developed to prevent and contain antimicrobial resistance was not just done by the Ministry of Health alone. It is a policy that's been jointly done between the Ministry of Agriculture, Livestock, Fisheries and Cooperatives, and the Ministry of Health. So what that means is that we are taking equal responsibility in controlling this creeping pandemic that we are all discussing, with very clear action points, 5 specific objective areas which I want to point out so that we all see ourselves in the vision. And I always say, if I have a picture in front of me, I would look for myself in that picture. If I don't see myself, I will not run with this vision. So there are 5 objective areas. One is increasing public awareness and education, and that's what we're trying to do today. The second one is trying to strengthen the surveillance and monitoring of antimicrobial resistance. And Joseph's work comes in very handy in here, because through the lab, we'll be able to know the trends, what's working, what is not working. The third component is strengthening infection prevention and control. If we prevent the infection from occurring in the first place, I will not need an antimicrobial agent. So that has to be enhanced. The fourth objective area is optimizing use, or what we call making sure we are using these antimicrobial agents in an appropriate manner. And what Gavin has just made reference to falls in this category, ensuring that laws are enforced, ensuring that people understand what needs to be used at what point. Is it the access category? Is it the watch category?
Okay, we seem to have lost
Is it the
Are you still there?
Capacities? Yes, I'm here. Can you hear me?
Yes.
We all need to understand our capacities as healthcare providers, or those that in the vet profession. What can I prescribe? What can I not? And when that is clear and we all accept our roles in the patient care cycle, it will be better for everyone.
Okay, now let us cross over to Patrick, and I would like to understand, when you are dealing with those residents of Kibra, what are some of the things you hear them saying? I'm ailing from this is why I think I need to go to the pharmacy and ask for this medication, or I need to ask my neighbor to help me with this and that. What kind of ailments?
First, I would say people would say cough. Majority maybe cough.
And a cough they would go for?
They may go to a chemist. They will maybe prescribed maybe with amoxicillin. Yeah, so, and this has been a problem because majorly when somebody has a cough, they'll run for that. And maybe if he goes to a health facility and a doctor prescribes something, if he doesn't see any antimicrobial it seems like the doctor didn't treat well.
Doesn't know what they're doing.
Yeah, the doctor doesn't know what he or she is doing. Okay. So they're like, I've paid my money, I've been given a prescription, but I don't see any antibiotic. So the patient will end up going to the chemist to buy medicine and not buying what was prescribed. Okay. Because they sincerely believe that what was prescribed will not treat the condition that maybe they're suffering from.
And that thinking is both for the adults, and they make that same decision on behalf of their children?
Yes.
Okay, which other ailments do you see? Fevers?
Yes, fevers. We have fevers in the community, especially for the children under 5s. That is okay because majority of the parents they have stocks of paracetamol.
Okay.
Yes.
Stomach bugs is something else that is listed in stomach problems, diarrhea, and whatever. Do they ever go to hospital to seek advice?
Yes, they go to hospital. In the community, what I can say is that for this child under 5 ailments, we are always advising our mothers to take their children to the hospital. Few cases where they'll try to prescribe medicine at the household level. That is using the traditional, the herbals, which also is a very much, it affects the children very much. But we always encourage the mothers to take their children to the hospital because under 5s are very sensitive. So putting these children into conditions or giving them medicine that is not well recognized may affect their health.
Would you say that you see more people prescribing medication for themselves as an adult other than their children?
Yes, exactly. So what I can say is that adults majorly, because when you feel a headache, just the way the pharmacist said, people will go for the painkiller that is highest. Instead of using maybe the paracetamol, they'll go for the diclofenac. You see? So they want a very quick solution. So that is majorly for the adults. But for the children, I would say that we always, and I see mothers always going to the facility.
Okay.
Yes.
Interesting perspective here, and I think I'll throw that to Dr. Wesangule in a moment to just understand if there is a difference in the health-seeking behavior between the women and men when it comes to antimicrobials. But before we get to that, let me hear from Joseph. There was feedback that said, in our area, we do not have enough labs, so I don't have the option to do that, so I just go straight to my pharmacy. How has that contributed to AMR?
Yeah, thank you so much, Catherine. The
Gladys.
contribution of lack of strong labs to detect resistance, sorry for my background, to detect resistance is really a big cause of resistance because the laboratory plays a key role in detecting resistant drugs from the word go to actually help the doctors know which kind of medication to prescribe for which kind of pathogens or microorganisms that would be infectious to particular individuals. So if we could strengthen our laboratory systems, then I think that could be one area where we could make sure that things go right. Sorry again for my background, for the purpose. And also we realize that research actually kind of plays a key role in informing programs in terms of the trends of infection in a particular country. So if our country could kind of, strengthen research, laboratory research in collaboration with many other stakeholders, like Wesangula talked about the surveillance systems that are in place, then I tell you by the end of the day, we are really going to be on the right track because we'll be in a position where we'll be linking up to the communities, we'll be linking up to the people across board, like we talked about the One Health system, where everybody will be together, developing policies together from an informed perspective, such that by the end of the day, whatever we do as a country, we do from a standpoint of information. Thank you.
Okay, Gavin has something to add on to that, Gavin?
Yes, so interesting points. And the main thing that I'd actually like to chip in is the fact that now you're thinking about the healthcare system in Kenya. And actually, if you were looking at the comments that were there previously, some people are actually complaining about the cost of the health system. The second thing that most people we are actually talking about right now is the availability or the lack of support for our laboratories. Dr. Wesangula has actually pointed out the fact that surveillance plays a key role in the action plan that is there for the antimicrobial resistance plan that is there. So when you really think about it, I think Joseph pointed out something. Patrick, sorry, apologies for that. Pointed out the fact that most people will actually, like you are in, let's say, in an urban dwelling, probably low income, so probably like Kibera. Chances are, if somebody has, let's say, a cough, probability is really think about it. If you could strengthen the labs that are in the level 3 and the level 4 hospitals, so that if you could do probably, let's say, hypothetically speaking, let's say you do 100 tests, you do throat swabs for 100 patients. It is easy for you to find out the specific microorganism that is actually affecting these people. And not really to generalize, I know it will be a bad thing, but it will also help, let's say, in the level 2 or where you don't have a lab, because you know that 80% of the population that have specific symptoms of A, B, C, and D point to this microorganism. So it will also help in getting the right antibiotic. So probably, let's say, I think Kenyatta National Hospital has done that. It's actually called an antibiogram. So you know that if a patient has a urinary tract infection, a lower urinary tract infection, the probability of it being caused by this microorganism, and this microorganism is this. So you can actually know the antibiotic that is actually sensitive to that microorganism, and you can actually treat it. So it's what we call empiric therapy, whereby you don't necessarily go to the lab, but you can get a higher probability of getting the right antibiotic.
Yes. Okay. And
thank you. Gladys.
Yes, Dr. Esangule.
Thank you. I'd just like to really emphasize what Gavin has said. And in a few words, it's not practical to have everyone walk into a hospital and have a microbiology test done. And that's why he's talking about those numbers and getting a probability. It will not be practical and also not cost effective. But when we have functional laboratories and you're able to determine that within this population, a particular fraction, like you say, let's say 80% of those presenting with this infection, these are the trends in terms of resistance and sensitivity. That then becomes very valuable data, even for us at the national level, in terms of developing what we call treatment guidelines. So
Are you there? Okay.
For microbiology, like other people to use the, yes, I'm here. So those facilities that don't have capacity for microbiology are able to use the treatment guidelines that have been developed nationally using the data that has been generated from different parts of the country. So that then provides adequate guidance for the different clinical teams to treat their patients in an appropriate manner. So not everyone will have to go and request for a lab test. But then if the labs are functional, then we have trends that provide data which is of good quality and reliable to guide the decision-making in the development of treatment guidelines.
Now, taking you back to the question I had said I'll pose to you, when it comes to the male or the females, which one of these genders do you see has more of the risk in terms of health-seeking behavior?
That's a tough one, Gladys. But generally, we know when it comes to health-seeking behaviors, even when you go into the hospital, let's say this morning, and I take an example of the pediatric wing, 90% of those that will be on the queues with the babies are the mothers. For males, generally, it's been found that by the time you see a man walk into a hospital, things are not very good. So their health-seeking behavior probably isn't the best. And there would likely be more of the riskier population that would tend to have a quick fix at the end of the day. And I think that's a good area also we want to further look at, so that we know amongst the males and the females, when it comes to antimicrobial resistance and self-medication with antimicrobial agents, which of these access healthcare facilities in a better way. But in terms of health-seeking behaviors, definitely the studies that have been shown earlier, the males have poorer health-seeking behavior compared to the females.
Okay. Now, Patrick, when you think about the Kibera area, Gavin has mentioned some of the gaps that could be there in terms of perhaps the labs, availability of labs, or even access to the same. What other gaps are there when it comes to health-seeking?
I would say some of the gaps that can be there is just the way Lecturer said, the health-seeking behavior. For us in Kibera, I would say as a community, men are poor health-seeking behavior. So that is number one. Number two, our laboratory system, lack of supplies. That is, even if it's there, if it's provided, maybe replenishing the supplies becomes a problem. So you can see that you are being given a prescription or maybe a lab request, so you're expected to go outside, and then that means you're going to incur a lot, maybe an expense that is higher than what was expected. So that means you are not going to afford that lab test. So that makes even the community members not able to undergo the lab tests that are being requested by the clinician. So number two is also, I would say that the mentality of the people. So I think also the mentality of the people should be changed. Just being educated, the importance of following the instruction of a professional health worker. So not just using the information that he has, but also following what has been provided by someone who is professional. Yes.
Okay, and I'd like to understand, when we think about the different genders, also we've got to think about the different populations, special populations. For example, the pregnant mothers, children with special needs, and definitely people with underlying conditions. Gavin, perhaps you can chime in into this. When somebody walks into a pharmacy, does the pharmacist ask them to declare this? And if not, what are the risks that could be involved in just dispensing over the counter for such populations?
Thank you for that. So now, most of the people who usually come to the pharmacy or the chemist, if you were to take the special population, one, you'll go with the pregnant mother or the expectant mother. One of the things that you'll realize is mothers tend to be very particular when they come to the pharmacy or to the chemist, because they know they're expectant. So some of them, and most of them actually rightfully, have that notion that some drugs are contraindicated or are not good for me because of my state or the pregnancy that they currently have. So ideally, most of them tend to say that they are actually expectant. I'll give you a small story. There is a mother who actually came to a chemist somewhere, something that I just saw on social media, and she was actually prescribed a drug called tinidazole. It's not, it's actually an anti-amoebic, but it's actually contraindicated for a pregnant, expectant woman, especially most of the time in the first trimester. So she didn't know that. So she actually took the drug first dose, and then she actually inquired what is going on. So by the time it came to our attention, she had actually taken the first dose. So most of these women, they will get the drug from the pharmacy, they will state their condition, and they'll also seek for a second opinion. You have those people who have special populations, the aged, you have those people with disability. So if you look at most of these people, one of the things that are usually there is they tend to have a level of, let me just say, the immunity is not as good as the younger population. So, and some of them, the ones who know Dr. Google, the ones who have been through all this, because of a lot of medication here and there, they actually tend to like and prescribe drugs for themselves. They'll actually come and tell you, if you give me, for example, a penicillin-based flucloxacillin, amoxicillin, it won't work for me. So really, if you're going to give me that, I'll actually go get it somewhere else. Unfortunately, it's actually a possibility. It's actually accessible. They can actually go and get it somewhere else. So now the prescriber is actually forced sometimes because of one reason or another. And key is actually the financial one, unfortunately, to actually give the same drug. However, I need to actually point out something that is actually very important. The World Bank actually indicated that the cost of healthcare by 2050 will, if we take care of this problem, will actually go down by 13 times the current cost, which is actually something that is actually significant. So something that we also need to look at.
Okay, so there are cost implications when it comes to antimicrobial resistance, as Gavin is mentioning. But before we go to break, let me hear from Joseph. And this is something that has been posed to you. If somebody already is resistant to a certain type of medication, is there a chance that the body can reset back to factory settings, so to speak?
We realize that the human system is actually kind of governed by antibodies against particular pathogens. So the body will actually kind of try to mount an immune response against this particular pathogen that is resistant to a particular antibiotic. So it will all depend on the amount of antibody that is actually being elicited by this particular individual's immune response. But going back to normal, again, it all depends on how an individual system works, because the way my system works is not the way Catherine's body's or immune system works. So it's kind of a big challenge. It depends on a number of factors. There are several issues on the aspect of, the phenotypes or even the genotypes of this particular pathogen, or in this particular individual that has experienced the kind of resistance. So it is kind of a big research question that I would think that's why I was saying, if we do research, then we can map out such kind of situations and see what really happens in terms of each case with resistance to an antimicrobial agent. So it is something that really needs a lot of work to be done on, so that by the end of the day, when we talk from data, or we talk from something that is known from a clear perspective. But just to add something is that the only thing that we really need to think about as a country is standardizing, kind of treatment guidelines, where everybody knows that when there is this particular aspect or situation, then this is the route to follow. And once we do that, from the perspective of surveillance that Dr. Wesangula talked about, then we'll be able to inform our people such that when we go to communities, we have the community linkage, where we kind of, like I would say, like politicians do say, the top down. So we look at things from top to down, where we walk down with the people until we reach to the last bit of a person within the community. That way we are going to help our systems, we are going to build our systems, we are going to map out the resistance based on age, based on gender, so that when we try to treat, we treat things from a known perspective.
Okay, now at that point, we take a short break. When we come back, it will be so important for us to address the institutional barriers as they have been mentioned here, in as far as why Kenyans would rather go and self-medicate and other factors that are driving AMR or antimicrobial resistance. We'll be right back. Thank you for staying with Your World. My name is Gladys Gachanja. Today the conversation is antimicrobial resistance, and this is actually abbreviated as AMR. Still with our panelists, but before we get back to that, I'd like to look at the other world. And this morning, pupils in the 5 years of primary school, that is year 2 to year 6 in the 47 regions of France least affected by COVID-19 no longer have to wear masks. Now, this is the case in Dinan in the Côtes d'Armor region in Brittany. Elsewhere, medics treat wounded civilians at a hospital in Marib after Houthi missiles strikes hit a residential area in the city, killing a woman and 2 children and wounding at least 30 other people. And now hundreds of insurgents and pro-government troops have died in the recent weeks after the Iran-backed rebels renewed their campaign for Marib, the government's last stronghold in the country's oil-rich north.
صورتك تمام خلاص على طول خلاص على طول اوكي
Back to studio to that AMR conversation, antimicrobial resistance. Dr. Gavin Orangi, Patrick Malaki, Joseph Osoga, and Dr. Evelyn Wesangula still with us. And ladies, or rather lady and gentlemen, I'd like us to get to the solution-oriented part of this conversation as we bring this to a close. And I'll start off with you, Joseph, from where you sit, you have mentioned a couple of things that need to be done, especially when it comes to harnessing the infrastructure and also for doctors to have a change of mindset in terms of diagnosis. What else do you think is vital in ensuring that we are able to keep AMR at a low?
Yeah, my thinking would be that if we could regulate and promote appropriate use of disposal of some of these drugs, because, I believe as a country, there could be some gaps on disposal mechanisms of some of these drugs, apart from what we have just said. So I think that is one other thing that needs to be thought about. Also, make information available to people so that by the end of the day, everybody knows the impact of antimicrobial resistance to the community, what it can cause, and how bad it can be in terms of the livelihood of human beings. And also, we need to, make it like, I would say, music to everyone, that everyone is singing at all the community levels, both at the hospitals, the pharmacies, and even the laboratories where we work. Because in many pharmacies, people go, and once I go there and I tell a pharmacist, oh, I'm feeling headache. So the pharmacist will ask me, when did you start feeling the headache? And then what kind of symptoms are you getting? So it is kind of prognosis. So I think we should kind of link prognosis and diagnosis so that by the end of the day, these two move together so that we don't just treat because Joseph has gone to the pharmacy and has asked for, an antimalarial or an antibiotic, and then the pharmacist just tells me, now you can take Coartem or something of that sort. But it has to be from an informed perspective.
Mm-hmm.
And that is the lab now.
Okay. Now, I had mentioned earlier that the WHO was very clear. If we continue the way we are, by 2050, we'll have more deaths that will be resulting due to AMR. Dr. Wesangula, could we perhaps underscore the risks that come with the misuse, underuse, or overuse of antimicrobials?
Okay, thank you so much, Gladys. And I just want to build on what you have said. From the reports and the projections that by 2050, if nothing changes in the way that we're using antimicrobial agents, we say that 10 million people will be dying every year. But I think what is also important for us to know is that half of these deaths will be happening in sub-Saharan Africa. That's closer home. So out of the 10 million, 5 million of these deaths annually will be happening in sub-Saharan Africa. Consequence, I think that's the worst that could happen is death at the end of the day. The second thing is the increased cost of healthcare, because if we cannot use the antibiotics in the access category, which are usually cheaper, and we only have options within the reserve category, which are like 100 times more costly compared to the first line or the access categories, what that means is that the cost of treatment will be unbearable. So it will not just be an effect on the individual, but the whole community will bear the burden. And that's why you find that when you wake up in the morning and you've been added to a new WhatsApp group and you have to fundraise for a medical bill for 14 million, 15 million over a period of 1 month. So what does that mean to us is that when I have an untreatable infection with a simple antibiotic, I will require to be in hospital longer for various reasons. Either I have a more severe infection or the antibiotic that I need to receive cannot be treated within the outpatient setting. Mm-hmm. I have to stay in hospital longer. That means the costs will be higher. The burden in terms of meeting the cost of treatment will definitely increase over a period of time. So I think those are the consequences that we need to be alert to. And also taking into consideration our health system, our poverty levels in the country, the economic status of majority of the people. So what we are saying is that the effective treatment will be out of reach for the common person if nothing changes in the way we are using our antibiotics. So there are two areas that I would want to look at: the social behavioral change aspect, the influences we have on each other, not just as professionals, but even to the public, and the power in engaging the citizens to take action based on what levels of knowledge that they acquire over a period of time. So those are going to be critical components that will actually help us to work on the social influences that are usually a barrier, because I will do what my colleague does, or I will do what my neighbor has actually recommended. And that is actually what drives our behavior at the end of the day. And we're not able to regulate this because of the influences that are around us. But if we can be able to address the social influences and regulate our behavior, I believe there's going to be a significant drop in the way we are using our antimicrobial agents. And that will help us to preserve those that are still working for the future generations. Thank you.
Very well said. And Patrick, I mean, we say that community health workers are the gatekeepers of public or primary healthcare, and you are the ones who actually disseminate the information coming from, as Joseph is saying, top to bottom. What kind of sensitizations programs do you have perhaps to ensure that the residents of Kibra understand what needs to be done and not be done when it comes to antimicrobials?
Okay, we have many platforms at which we can engage our community members. First, we have health talks at the facility level. So where as community health workers, we are able to go to the health facility and pass health information to people who are seeking health that day. Yeah. So what we do, we educate them, and I think that will be a good forum for even the patients who are there to understand the meaning of misuse of antibiotics. And when everything is, and when drugs have been prescribed by the clinician, they're supposed to take the medication as it has been indicated. Secondly, we have community dialogue days, where we are able to assemble as a community, address our issues in terms of health. So this is another platform where we can engage the community members and educate them on the importance of using the antibiotic in a proper way. Third, we also have the barazas, the chief barazas. This is also another forum where, as community health workers, we use to educate community members.
And definitely this is something that can be borrowed across board, because this is a burden that is actually being experienced by the country as a whole. For Gavin, we mentioned some of those institutional barriers, and low numbers of health practitioners is actually top on that list. If there is no health practitioner to work with me in as far as what I can use, what I cannot use, or even tell me how to use it, then we still have a huge gap. How can we bridge this one?
So in regards to antimicrobial stewardship, the main thing here is antimicrobial resistance, pardon me, we need people who are specific, people who are watchdogs for antimicrobial resistance. And these are who we call the antimicrobial stewards. So one of the things is training. We need to inculcate antimicrobial resistance into our curriculum, that is in the health colleges, from the nursing to the clinical to medicine to pharmacy. It's something that needs to be strengthened a lot. Secondly, and this is also very important, is you need focal people who, when Dr. Wesangula is seated at the national office, can actually contact and say, in terms of antimicrobial resistance patterns in, let's say, for example, Makueni, what are the patterns? What are the pathogens that are actually resistant to this drug and this drug? So that is actually very important. Secondly, and I think this also needs to go to the community, you need to look at things in regards to accessibility of these drugs. These drugs, you should not buy them the same way you would buy probably airtime or bread. These drugs should come with a prescription. This prescription, at the pharmacy, you need the prescription to be explained to you, be it in English, Kiswahili, or your mother tongue. whichever, even sign language, whichever that you'll actually understand. So it should not be accessible the way anything is. Secondly, these drugs, the reason why I think you'll get most people in the community are actually self-prescribing is because of the affordability. So these drugs need to be affordable. Now, I know the government in the Big Four agenda prioritize health as actually one of the aspects. So these drugs need to be affordable. I don't know the mechanism for that, but they need to be affordable so that these patients can actually buy them. Then lastly, and this is also important, is they need to be available. We have had a lot of things here and there from the KEMSA, these drugs are available, these are not available. If you go to a government hospital, probably these drugs are affordable. But if they are not available in the public facility, chances are you'll actually go to a chemist and get either a cheaper version, a generic version, or a wrong version of the same drug. Will this drive up antimicrobial resistance? For me, yes, it will.
Okay, and Gavin, still on how we need to govern or put parameters around the use of antimicrobials. Are you for the suggestion that perhaps the Pharmaceutical Society of Kenya needs to be regulated or governed by a bigger body?
That's a tricky one. Probably what I'd say is, and I'll just use what I like, is now we need to empower the pharmacist so that he's in a place whereby he is the focal person, the steward, the overseer of the drugs. I'm sure there's a bill, the Kenya Food and Drug, KFDA bill,
yes,
that is currently in the process. So and I'm speaking from my perspective because I know it has a lot of political debate in it because a lot of societies are here and there. The PPB has been doing a good job. As a pharmacist, if by being inculcated in the KFDA will actually improve the practice of pharmacy, well and good. If not, then I think we'll still stick to I think it's CAP 244 that is the Drugs and Poisons Act, so that at least we can steward or we can be the overseers of the drugs. Yes. Okay,
Dr. Wesangula, there's something that I need you to speak into or underscore, and this is the affordability of these drugs, because as we've said, underuse is also a huge factor when it comes to AMR. How is the Ministry of Health going to help along with ensuring that there is affordability of these drugs?
Okay, thank you. And I know that's also a big one. And I think one of the best ways of ensuring affordability, not just of the drugs, because remember, we talked about the whole spectrum of care. It's not just the drug. It's also the affordability of seeking care. It's affordability of the diagnostics that are supposed to guide the end result or the prescription at the end of the day. So through the universal health coverage agenda, I know that's one of the ways in which the health system is going to lower the cost of seeking care for everyone. That's one of the best ways of ensuring that everyone has access, not just to the drugs that they require, but the best healthcare possible at the end of the day. Number two, we are also looking at the possibilities of local production of antibiotics. How can we improve the production? Because when the cost of production goes down, then that means also the cost of the health products and technologies will also reduce at the end of the day. So those are going to be big elements that are going to ensure that the affordability of the medicines and the diagnostics that are required is actually achieved for all Kenyans at the end of the day, to ensure that that everyone is able to get the right medicine in the right quantities at the right moment when they need it. Because in the absence of affordability of the whole healthcare, all the healthcare services, that it's not going to be possible for us to offer quality or optimal care. So it's not just a focus on the affordability of the drugs, it's every service that is provided throughout the healthcare system.
Okay, and for yes, Joseph, there is a question here. How many medical microbiologists do we have that can actually cater for this population? Is there, or is that a gap perhaps that we need to look into?
Yeah, of course, that's a big question, I would say. But I would say that it is a really big gap that as a country we need to look into, so that we strengthen our microbiology laboratories in the country. So if that can be done, then I think the country would be at a better position to kind of tackle the aspects of, antimicrobial resistance. And also the aspect of commodity, you know, is actually playing a big role in this. So the commodities that are needed to kind of do this particular aspect is really key. So as a country, I think commodity is something that really needs to be looked into to ensure that the labs that are conducting this particular kind of tests are kind of equipped to an extent that if I go to that particular laboratory for a particular test, then they are able to do for me the test, and I come out with a susceptibility kind of report that I can present to the medical doctor that I went to the hospital, to the laboratory, and I was sent to the lab, and this is my report based on what sensitivity or susceptibility test has given me. So that will guide a doctor like Wesangula to know the kind of course of action to take as far as the infection that I am suffering from is concerned. Besides that, the country needs to think in terms of reduction of incidence of some of these infections, because that would also play a role in making sure that we contain this kind of creeping pandemic, so that by the end of the day, most of us don't end up in a very bad state of affair. The other aspect that I think about is the awareness. We actually spoke about awareness. So how many people in our population are aware about this particular aspect? If you go to the society today, even in schools where we learn, or where our children go, and you ask them about anything to do with resistance, using the simplest language possible, you might realize that none of them know about this, or even the teachers that teach them know about this. So I think it is high time that people are supported, the professionals are supported to create awareness to the public, so that we know exactly what is before us, so that it does not come to us like something new, while it is actually living with us. Thank you, and over.
Very well said, because I'm sure a lot of us are hearing about antimicrobial resistance today for the first time, but I'm glad that you all here to actually break this down for us. But quickly, Patrick, and this is something that has been posed especially to those that are at the community level, when it comes to nutrition. It is so critical when you're taking some of this medication because they're strong. And some people actually stop using them because they don't have the basics, food, to actually support the use of the drugs that they're given by the doctors. As a community health worker, do you have surveillance to understand those that need this kind of support?
Yes, we have surveillance because as a community health worker, I have a total of 100 households which I'm supposed to look at. So, and I'm supposed to check each and everybody that is living within that locality. So we have special cases, like people suffering from, people having tuberculosis, people who are on HIV, AIDS on heart, people who are cancerous or who have cancer. So these are cases where they have medication, but now food is a problem. So we always find ways and means to mobilize resources as a community, as family, and also using the development partners within our community.
Okay.
Yes.
Poverty plays a huge role also in fueling AMR. Well, even as we close, Dr. Wesangula, I think this is so important. Many would wonder, why are we hearing this perhaps today for the first time about AMR? Should we expect, now that there is a report, to see perhaps more advertisement, more communication around the effects of the same?
Thank you, Gladys, and I'm really excited that we are on this topic this morning. Next month, we will be marking the World Antimicrobial Awareness Week. And this happens every 18th to 24th of November every year. And we have made a deliberate effort to engage the citizens in this process. Following the launch of the report last week, there's power in the people. And I think there's a deliberate effort to ensure that there'll be more in terms of information, education, and communication. I want to say that at the national level, we are governed by the National Antimicrobial Stewardship Interagency Committee, which actually is made up of representatives from different ministries, the Ministry of Education included. So what that means is that there's every effort being put in place to ensure that information goes out and awareness creation runs on a daily basis throughout the public setting and also within the professional circles. So we expect to see more on antimicrobial resistance, more information both to the general public and to the professionals. And when I say professionals, it's across board, not just in human health, but also in animal health, and also to those that are professionals in the environmental sector, because there's also contamination that's going out into the environment. So it's not a new phenomena. As early as 1948, we already had predictions and we had already seen resistance emerging to penicillin. But it's just that we have not been keen to the issue. Probably our goals have been different and our priorities. But now that we have statistics regarding the gravity of the issue at hand and what consequences we are facing if we don't take action, we have no option but to heighten our level of creating awareness and just making sure we have many champions out there talking about MR, its consequences, and the benefits of using antimicrobial agents in a prudent manner. Thank you.
Thank you, Dr. Evelyn Wesangula, who is the head division of Patient and Health Workers Safety at the Ministry of Health. We're also joined by Joseph Osoga, who is a medical microbiologist in Kisumu, and Patrick Malatki, who is a community health worker attached to the Kibera area, and of course, Dr. Gavin Orange, who is a clinical pharmacist. Thank you all for helping us understand antimicrobial resistance a bit more. And as we said, this is being called a creeping pandemic by the WHO, actually pointing to the fact that if we don't do something about it, by the year 2050, 10 million deaths will be attributed to the same every year. So here is a chance to actually avert the same, and it all starts with awareness. Well, tomorrow, we shift gears, and with the election season gathering momentum in the country, my colleague Victor Kiprop will be interrogating the role of the youth in the electoral process. How can their voices be magnified? More from tomorrow morning at 7 a.m.